Hello and welcome to another TGIF episode of the Pharmacist podcast. How has your week been, guys? I hope this Amatan is not showing you shege too much. It's showing me a little, but we are dealing with it. And that shows us that Christmas is in the air. How are you preparing for Christmas? Christmas is always different, right? We know that. So, what will I be talking to you about today? This episode will be piggybacking off the last episode. We talked about TMI last Friday, and today I'll be asking you a question. Do you trust your pharmacist? I know I mentioned trust last episode. I asked a few questions. I said stuff about trust, but I want to take it in another dimension today. Like when you visit a pharmacy, for example, you didn't want to go to the hospital, or you've been to the hospital and you did not get the expected result from whatever medications you were given or you were prescribed. Now you are seeing your pharmacist. What comes to your mind when you see them? Do you trust them enough to give you the right medications? Because a lot of things happen in pharmacies, guys. A lot of things. And sometimes when these things happen, I just shake my head like, God, do this profession, especially in the community. Like, you explain your situation, your condition, you're consulting with me, you want me to recommend a medication to you. Then I recommend this medication. And you're telling me, are you sure this will work? Do you have this? Do you have that? Let me call my nurse. Like, it rubs me off wrongly. If you don't trust your pharmacist, why did you come to the pharmacy in the first place? Like, why are you complaining to me? Why not just come in, ask for whatever medication you have, and be done with it? Don't get me wrong, guys. I'm not trying to feel myself, or how should I put it? Or I'm not trying to talk anybody down, but this is so common, and I'm like, if you don't trust me enough to give you the right medication, then why are you here? Why are you talking to me? Why did you waste my time, telling me stuff and expecting me to bring a medication to you? Then you're not asking me, are you sure this will work? Are you sure I need this too? Can I take one of them? No, now we are professionals. I think Nigerians are cynical in nature. You get? Because we think that there's an ulterior motive to everything that people do, even in professional spaces. Imagine you going to a doctor now and you telling them your symptoms, your signs, and all of that, and they prescribe medications. They now give you this prescription, get these medicines, and you're asking them, are you sure this is what I need? Imagine. We were trained for this. We are professionals in this. Some people even go as far as saying, Abby, you just want to sell medications to me. We are not merchants. We are pharmacists. We are trained in the art of medicines. What medicines do, how to use them for your benefit. So if you can't afford medications I'm giving to you, just say that, okay, I don't have this much. This is not my budget. Please calm down. If I have an alternative to that medication that will still do the same thing that's cheaper, or I have a generic brand, I'll give it to you. But don't start asking me, are you sure this will work? Are you sure it's okay? Will you give me one of the two? It doesn't make sense, guys. It doesn't make sense. I just said this is a good topic for a TGIF episode, really, because I've seen a lot of it over the years, and it's not nice. Once you tell me your condition, your symptoms, and I present you medications that you use, and I tell you the price, of course you're buying them. If you can't afford them, say, okay, I can't afford this for now. Please get me cheaper brands. Then we'll understand. Don't be like, are you sure I need all of this? Are you sure I need it? Can I just get one? Guys, it's offensive, really. That's the truth of the matter. It's just like you're telling me I don't know what I'm doing. You understand? Some people say, bring it, let me see. And after you have shown them, they will now leave it and go elsewhere to buy it. An average patient comes in with the mentality of these people just want to meet targets, compared to you going to the hospital, paying consultation fees, and at the end of the day, some medicines that they even give them, if you see them, you know that they are not even worth the amount they have paid and the waiting time. You now come into the pharmacy and makes everything easy for you, and the pharmacist directly consulting with you with little or no waiting time, with little or no consultation fee, and I give you medicine. You are now asking me if I'm sure it will work. That's an insult to me and my knowledge, which I'm giving you for practically free. I'm not saying it's wrong to ask how your medications work. It's fine, you can ask. The pharmacists are even always willing, most times, to explain to you why they are giving you a medication and how it works. I do, even without the patient asking, so they can know that they are getting benefits from the medications I'm giving to them and they are not wasting their money. But others want you to start marketing to them as if you are pitching to them, like you're convincing them to buy. No, this is a health care service. It's not just any other service or good selling business. I need people to understand this, and that's why I'm bringing this. So don't expect your pharmacist to start convincing you to get medications. Once you are in the pharmacy, you need this medication for a condition, right? Get it. I'm not saying you should break the bank. Tell your pharmacist what you can afford, the amount you have. I'm sure they'll find something within your budget that will work for you. All right? So there are ways, to express yourself that, okay, I can't afford this. Don't be like, if it doesn't work, I'll come back and collect my money. It rubs off wrongly. Really, we are not magicians. You come present with symptoms. Only a few people go to the laboratory and bring test results. Some people will ask to go and run tests. They will say they don't want to. So we do this thing with symptoms. And I can tell you confidently that 80% of the time we're right. We give you the right medications. Some doctors will still run tests, and at the end of the day, they will give you medications. It still won't work. It's allowed. It's a medicine. Nothing is set in stone. That's why those Oyibo people, even after they have run tests and they give you medications and it still doesn't work, they'll troubleshoot again. Maybe there's something else involved. But in Nigeria, doesn't no work. We should not be. So this is what I've brought again today. You know that if there are issues, I'll talk about it. And there are some issues that I just reserve for TGIF, because that's where we can relate very well. That's when I can express myself in a less professional way. And that's why I'm saying it. Please, if you know you don't trust your pharmacist enough, don't go there and insult them. Who could go to the hospital? Hospitals are there for you. Go and pay your consultation fee. Go and see your doctor. Bring your prescription. We will attend to it and dispense to you. That is no problem. But if you are coming to consult, have it at the back of your mind that this person knows what they are doing. This medication they are giving to me is because I need it at this point. All of the medications. So don't have it at the back of your mind like they want to cheat you, they want to push medicines on you or something like that. It is not right. Trust your pharmacist enough to be open to them, to tell them your symptoms, to answer their questions honestly, and to accept the treatment they give you. We are very intelligent people. Let me just tell you, if you don't know, because it's not easy. You self, you are just hiding it. So don't come in and be feeling as if we are out for your money. No, we also have our reputations to protect. So we'll not give you things that at the end of the day will not work for you, and then you start bad mouthing and maligning us about. No. Once you start pressing doubt in my abilities, you have already demotivated me. Even the medicine will not work as it should, because part of the psychology of medicine is you believing that it will actually work. That's our duty, to make you believe that this will work, because we are giving you the right medicine for the right condition. You start bringing your doubt and all of that. It's usually offensive. So guys, that's what I have for you on today's TGIF episode. And Have I told you that we're closing for the year? Well, we have 2 more episodes to go. So next week, Friday, will be the last episode of the Pharmacists podcast in the year 2023. And that is officially the end of season 1. Woo! Wow, you guys have been with me for 3 months now. 3 good months. And I can't thank you enough for your support so far. And like I will say, I'm Oliver Twist asking for more. Please like, follow, share, subscribe to the podcast and help us to even grow more in the year 2024. So let me wish you Merry Christmas and Happy New Year in advance. We have just about a little above 2 weeks left in the year. And I'll see you next time. Again, pardon my voice. I don't know. This Harmattan has decided to deal with me. But me too, I'm showing it my own shaggy. So, till next time, stay healthy and God bless you.